Okay, welcome again. We are going to get started with just quick introductions. I have two mics, and we're going to see how well we do with just starting on one end of the room and then going off to the other end. So how we're going to do this is I'm going to start at the end, and then you're going to pass it across this way, that way. Once this is done, I'm going to nod, and you guys will start. It's like the wave, but with microphones. So thank you so much. We're going to do that as we are getting ready for our presenters.
State my name. Okay. Hi, I'm Carol Kale. I'm a retired nurse, but a mother, grandmother, and great-grandmother. And I think this is probably pretty pertinent with the information, so that's why I decided to come. Vaccinations are sort of a good thing to know about.
Hi, I'm Ashley with Healthy Moms and Babies. I'm a nurse on visitor, and I wanted to come to make sure that my clients are aware of vaccination recommendations and things like that. Hi, I'm Kira Summers. I'm also with Healthier Moms and Babies, and I'm a nurse on visitor for students in Grange County, and I'm hoping to bring this information to the community to help inform my clients better.
Hello, my name is Jessica. I'm with Parkview Health, Women's and Children's Outreach. I'm a community health worker, and I'm here just like them to give more knowledge.
Hi, I'm Janae Moore. I'm also with Parkview Health, Women's and Children's Outreach, and I'm a community health worker.
Hi, my name is Nan, and I'm a Parkview community health worker, Women and Children Outreach. I'm a new hire, and then today I'm sharing with my co-worker.
Hi, I'm Cherise. I'm a pediatric nurse navigator with Parkview, and just here to gain more knowledge.
Hello, I'm Melissa. I'm a nurse navigator through Parkview too.
Hi, I'm Flo. I'm working with Mother's Hope, and I am a care coordinator.
Hi, I'm Mary. I go to the University of St. Francis, and I'm interning with Mother's Hope.
Hi, I'm Samantha. I'm a care coordinator, and I'm also with Mother's Hope.
Hi, I'm Maddie, also with the Mother's Hope, and also a care coordinator.
Hi, I'm Noel. I'm with the Mother's Hope, and I'm lead care coordinator.
Jeannie Berger. I'm with the Lutheran Agency for Mission to Burmese. We talk to a lot of pregnant Burmese, want to be informed.
Ashley, I'm the one of the mom.
Hi, I'm Kiki. Liz. Hi.
Hello.
Okay.
Hi, I'm Kiki Hunter Davis with Parkview Community Nursing, and I am the Safe Sleep Coordinator.
Hi, my name is Ayo. I'm one of the community health worker for community nursing that works with pregnant moms.
I am Brittany Dean, and I am a community health worker with community nursing for Parkview.
Jerry Hillebrand. I'm with community nursing. I teach prenatal classes down at the FRC, at the Furge grades, and safe sleep classes.
I am Chris Howell. I'm a community nurse also, and my focus is those experiencing homelessness.
Hi, I'm Sarah Cutler. I'm the outreach coordinator with Iris Family Support Center, and going to be co-leading the prenatal program at the DeKalb FRC.
Hello. I'm Alyssa Salter with DCS. I work with foster families. I like to be informed on any kind of information that will help the family.
I'm Brittany Fields. I'm with DCS as well. Vaccinations will be important for us to know what our children can or cannot have, or what's important to keep DCS informed of vaccination.
Hi, my name is Letitia Cobb. I also work with DCS with foster care, and I just wanted to be informed.
I'm Ashley. I'm an MSW intern over at Parkview Women and Children's.
I'm Corey. I'm a social worker in women's and children's, specializing in bereavement support, and I'm a Parkview.
I'm a social worker at Parkview Women and Children's Outreach, specifically in the Carew OBGYN office.
I'm Jasmine Miller. I'm the Echo Case Manager at Furge Social Services.
Hello, I'm Mindy Theard. I'm the Director of Child Hosting for New Mercies Ministries.
I'm Gina Dundon at Portland Community Schools. I'm one of the nurses.
My name is Alyssa Obrey. I'm a birth and postpartum doula with the Doula Network of Fort Wayne and an RN at the Family Birthing Center of Huntington.
I'm Shannon Spikes. I am a birth doula, also a part of Doula Network at Fort Wayne and DuPont Hospital Doula Group, and lactation specialist.
I'm Angie Richard, Center Manager at a Hope Center in Fort Wayne.
Hi, I'm Dorothy Jackson, retired nurse. And I just want to say hi, Judy. Worked with you in coronary care back in the 80s, so it's nice to see you. But anyway, I'm here because of my sorority, PIC sorority. We do a lot of community service, a lot of education, and so this is important for us to be here.
Hi, my name is Phyllis Bragg, and I'm also a retired registered nurse, and I'm vice chair for Calumet PIC Nursing Sorority for our programs out in the community. We also do safe sleep education, and we also partner with Supershines. So it's very important for us to be here today.
Hi, I'm Isabel Diaz. I'm a family advocate with Healthier Moms and Babies.
Hi, my name is Shelby Price, and I'm a family advocate with Healthier Moms and Babies. I work in Allen and Noble County.
Hi, my name is Rebecca. I'm an advocate at Healthier Moms and Babies.
Hi, I'm sorry. Maria Martinez with Healthier Moms and Babies, is a worker and family advocate.
Hi, I'm Tara Held. I'm the Every Birth Network Manager at Healthier Moms and Babies.
Hi, I'm Courtney Gibson, and I'm a family advocate with Healthy Moms and Babies.
Hi, my name is Emil, and I'm an intake worker at Healthier Moms and Babies.
Hi, my name is Terry Herman. I'm a family advocate at Healthier Moms and Babies.
Alrighty, thank you everyone. I'm so happy that you guys are all here with us today. These are some of my favorite moments as I'm not in direct services anymore, but really still love the work and love to see all of you guys. I really wanted to quickly say Britt Neihart usually does a quick overview on FEMUR for the fetal infant mortality data. She was unable to be here today, but she also did say that there was not anything in specific that she had to share. And so she apologized, but she was part of the agenda, but then was unable to make it. Also quickly before we get started, and I will not put it up yet, but I will put it up at the end. Towards the end of our program, I'm going to share a QR code. Healthier Moms and Babies, they are going through a new strategic plan, and they really want to get the input of the community as they are preparing to do that, as they are services for the community, and they think that's very important. So at the end of the program, I will put a QR code that will take you to that survey. If you guys could please complete that for them when you guys have time, that would be really helpful. And I will now introduce our speakers. Here with us, we have Super Shop team. We have Connie Heflin, she's the executive director, and Danyel Furge, she's the outreach manager in education, and also an RN. And we will have Dr. Giaquinta, who is on his way, as you guys all know, to pediatrician. So he's making his way down. But we will start with Connie and get started. Are you going to use the mic? That would be great. Okay.
Hi. Can you hear me? Yep, there we go. My name is Connie Heflin, and I am the Executive Director of SuperShot. Like we said, we have Danyel here today with SuperShot as well, and Dr. Tony Giaquinta. He is on his way. He's sharing his location on the phone, and it looks like he's about 10 minutes off. So when we're here, and we appreciate all of you for coming today to talk about vaccinations, recommendations, the changes that are happening, and combating the confusion. There's a lot of confusion right now around vaccines because of all the noise coming from a federal level, and so we really appreciate your time today to let us talk about it a little and help share the information. So, like I said, my name is Connie Heflin, and we thought we would all in our introductions talk a little bit about why we believe in the importance of immunizations. So this is me, and this is our son, Jack, and he is just about ready to turn 5 years old, and 2 weeks before that picture was taken, he was diagnosed with a brain tumor. And this is the day he went in before surgery, for his brain surgery. And I know firsthand as a parent what it's like to have a sick child and to just be brought to your knees when your child isn't healthy. And so for me, that's why I really believe in the importance of vaccines. Vaccines are safe and effective and one of the best ways to protect your children against serious diseases. And I just really, there's a lot of things in life that you can't control. There's so many things as a parent that it's out of your control and you worry about as a parent. But you can get your child vaccinated, and it will protect them from so many deadly diseases. So it's why I do this, my job, because I believe in children's health. And I know what it's like to not have a child that's healthy. He's 25 years old now and doing well and totally healthy now, and he came out of that. But it wasn't easy. We didn't know. It was low-grade cancer, and we didn't know for a long time how that was going to go. And we didn't have control, and I didn't have control as a mom, and that was a really uncomfortable feeling. And I also believe in the importance of vaccines because vaccines are something that we do not only to protect ourselves, our children, but we do it because it protects our whole community. If I get a vaccine, I don't get sick with what it's preventing, and I'm not going to the grocery store and spreading that virus with everybody else around me. And so if I'm not spreading it, it's helping keeping everybody else healthy. And there are a lot of kids, when Jack was having that, going through all of that, he needed everyone around him to get, it was way before COVID, but to get their flu shot. That was what the doctor sent us home. It was during respiratory season. And he said, you absolutely have to have everybody around him to make sure they're up to date on their vaccines. So that's my why. It's real, and I really feel that vaccines are important, not just for us as individuals, it's important for us as a community. So that's why it's so great to have all of you. You are front-line workers, really protecting the community and helping, just keep our whole community healthy this way. So about SuperShot, a little bit about SuperShot. SuperShot is a local nonprofit. We've been here in Allen County since 1992. We were started by a poor handmaid, Sister Mary Conrad Kershaw, and the local health commissioner, Dr. Jane Ernscher, back in 1992. It was a local volunteer initiative, and then in 1993 we became our own nonprofit. Since then, we've been protecting children and now adults from vaccine-preventable diseases. Going through this whole timeline, we worked out of temporary locations. A lot of our community partners in the room gave us temporary spaces. We were in Parkview, we were in Lutheran, we were in all the different hospitals where they gave us free spaces, but back in 2019, Parkview said, hey, what about this permanent site? And so we are at 1515 Hobson Road. That's our main clinic now, and we have a permanent location, and that's where we're seeing, that's our largest clinic location. We can talk more about that. But last year, we provided almost 24,000 community members of 37,500 doses of vaccine to help keep the community healthy. And we also partner with 10 different school districts there, to take vaccines into the school systems. So Super Shot, we provide vaccines for children that are Medicaid insured or uninsured. That's what we call this VFC program. That stands for the Vaccines for Children program. And that ensures any child that is uninsured or Medicaid insured has access to vaccines. We also participate in the federal program called the 317 program that provides vaccines for uninsured adults. And then Super Shot also accepts almost all commercial insurance. So we can serve children and adults, uninsured or commercially insured or public insured. Vaccines, the Vaccines for Children program is a very effective program that has prevented millions of illnesses, prevented deaths, and then when it comes to vaccines, we're really saving healthcare costs as well. It costs a lot less to prevent a disease than it does to cure it. So we're one of the state's largest providers of VFC vaccines and participate in the VFC program. Like I mentioned, we have 3 clinics. So our main clinic is at 1515 Hobson Road. It's down the way from the VA hospital. We have evening hours and Saturday hours, so we really are trying to accommodate families. You can make an appointment by calling our phone number so they can talk to somebody live, or they can register for appointments online 24 hours a day on supershot.org, or patients can always walk in. We take walk-ins. So we really try to be accessible to the community. We're on a public bus route, and we have language translation services. We have Burmese and Spanish-speaking staff, and we also use a system called Boost Lingo where we can translate into over 120 languages on the spot through video. So again, we ask people if they have insurance to bring their insurance, but we turn nobody away for inability to pay. We ask for a $15 copay per vaccine if they don't have insurance, but if they don't have it, we never send a bill. They just have to sign a piece of paper declination that they are not able to pay. And we don't want anybody to ever feel uncomfortable about that. Our mission is to make sure they have access to vaccines. We just have to provide that proof. We also have a clinic up at Grable, where we're there up in the Grable Missionary Church every other Monday. And then we partner with Fort Wayne Community Schools and Parkview Community Nursing, and we're down at the FACE Center Monday through Friday, every day down there. So, okay, so that's a little bit about Super Shot, just so you have an understanding of who we are. We're a local nonprofit that breaks down the barriers of access and affordability to vaccines. Been in the community for over 30 years. So vaccines are our thing. That's what we do. We do vaccines all day, every day. And back in 2025, a lot of changes at the federal government level started happening. So for Super Shot specifically, we were scheduled to have the CDC come to Fort Wayne in April of 2025 to provide what's called a Pink Book training. So Pink Book is the big training for anything and everything, all vaccines. And so we knew we were in trouble when the CD said in January of 2025, we were no longer providing vaccine education. So they canceled that CDC training that was supposed to be happening here in Fort Wayne, April 2025, and then things kept evolving. So later on in 2025, RFK Jr., our Health and Human Services Director, he replaced the members of the Advisory Committee on Immunization Practices. So that's what this abbreviation ACIP stands for, the Advisory Committee on Immunization Practices. So when RFK came into office, he let go 17 long-standing ACIP members and put in his own people. And so a lot of them are what we perceive to be a bit vaccine skeptic. And so that has just continued to cause changes coming from the CDC. So We are going to go through a lot of these changes. The biggest changes came just this past January, in January 26th, and it has caused a lot of different agencies to follow the American Academy of Pediatrics, their vaccine schedule for children, veering away from the CDC's recommended childhood immunization schedule. So we're going to go through all of that, and we're going to talk about that in detail. But that's what's driving all of these changes and why there's confusion out there. Because we have the CDC that has one childhood recommended vaccine schedule, and then we have the AAP and all of the providers following AAP now. So that's what's driving this, and that's why we hope we can help clarify what these changes are about. So when you're talking to families, you're equipped with that information and know exactly what it's all about. So on January 5th, 2026, this is when we really saw the biggest changes, like I referenced. CDC removed 6 standard vaccines from the recommended childhood vaccine schedule. And that's when locally we said, okay, things have gotten serious enough. We really have to work together as a community to have one voice on the importance of vaccines, and we have to get this messaging out. And we will show you that. We have a public service announcement, and we will show you that at the end of the presentation. But we really, again, think we can't solve things at a federal level. We need to work locally. We really need to work locally on communicating what these changes mean, who has access to the vaccines now. The good news is all of the vaccines that the CDC recommended in the beginning of 2025, that's what AAP is still recommending now. Insurance companies are paying for those vaccines, and most doctors' offices are following those AAP recommendations. So for parents, access should be the same right now. There shouldn't be that problem, but it's the confusion that it's causing with these different recommendations. So I am going to turn it over to Danyel now, and she's just going to talk about how vaccines work real quick.
Hi, I'm Danyel. I'm the Education and Outreach Manager at SuperShot. So a little bit about my why. Family and community is important to me. I had nurses in my family growing up. I saw the way my family members were taken care of in and outside of the hospital. I love my family and friends, and I feel like just having strong healthcare providers, community health workers, all of the people in this room, places that touch families at every point of contact before they get sick, while they're sick, and after. And so to me, I have spent most of my career in community or public health, and so prevention and those types of relationships have meant a lot to me. So, and then recently I have my son. He is 11 months old today. And so he's the cutest baby ever, right? So, and now obviously he is affected by the health of the community that he's in. And so it feels for me even more personal to make sure that he is protected himself, the people around him are protected, and he's affected by, what's going on. So, so this is just a little bit of a vaccine overview. Super basic, super layman terms, and hopefully helps you be able to explain a little bit if families have questions. So how do vaccines work? So the whole point is that a vaccine would introduce a weakened or dead virus or bacteria to the body. Your body would initiate an immune response and then learn to protect itself against that by making antibodies. So if you came in contact with that sickness, your body would recognize it and fight it off. And hopefully either you wouldn't get it or it would be much more mild if so. And so in the vaccine world, there's generally live or non-live vaccines, and the live vaccines are just weakened or attenuated versions of those virus or bacteria, and you just need one or two to have presumed lifelong immunity. And then the non-live vaccines are dead or inactivated versions of the virus or bacteria, and you do need multiple repeated doses of those, and you may need boosters later in life to keep up with that immunity. So I you'll see a picture later of the immunization schedule, and so that will show you why there's certain vaccines that are more often and repeated doses, and why there's some you only have 2 on there. And so when we look at immunity versus protection, that first category is immunity. So you're going to have that through active or passive immunity. The active immunity is your body doing the production of the antibodies. So that's either from exposure to a disease or illness, or by getting a vaccine, so your body makes those antibodies. Passive immunity, that's going to be temporary, and that is most commonly transferred from mom to baby. So that's why there's still recommendations for pregnant women to get vaccines when they are getting flu or COVID, RSV, or Tdap. Mom is making those antibodies. They are then transferring to the baby after they have made that, and then the baby is protected for a short while of time after they're born until they're able to be old enough to start getting those vaccines. So that protection is really important there. And then when we look at protection as a whole, that's either going to be through these versions of acquired immunity or herd immunity or community immunity. And so when I talk about this, I really like looking at this picture here. So the top photo is on the left-hand side. You see a bunch of blue people, which are not immunized, but they're healthy. And then there's a red person there who is not immunized and they are sick with some kind of disease. And so you see that there's only a few of them in that community, but how quickly that disease or illness takes over and spreads. And so that next picture adds in a few yellow people, which are immunized and healthy. And so you can still see that those the percentage of those people who are protected is pretty low. And so on the right side of that middle picture, you see that disease is still spreading pretty quickly. There's still some healthy people, but again, majority of that population did get infected. And then the bottom photo, we see way more on the left here of people who are immunized and protected against whichever disease we're looking at here. There's still some who are unvaccinated, still some who are sick, but you see on the right side that that disease is way more contained and has been controlled due to the herd immunity or the collaborative efforts of the community to prevent that. And so that is going to look different for each disease. So something as contagious as measles, you're going to need a higher percentage of the population to be protected to hit this threshold level of community protection. So we need closer to 95-ish% of the community to be protected against measles. They would need to be vaccinated. So that's a higher number. Other diseases that are less contagious don't have as high of a threshold level. So speaking of measles, I just want to put the plug in there that United States declared measles eliminated in 2000, and elimination status is when a country has been free of continuous domestic transmission of a disease for 12 months. So that means people within the country aren't getting sick of that and spreading it to each other. So we know individuals who are traveling, there's always that risk and likelihood that there may be something caught at another country that doesn't have a certain disease eradicated or eliminated. They bring that back here. Generally, in highly vaccinated populations, that's contained and gotten rid of. But right now, we're seeing a lot of measles transmission in certain communities, and so our elimination status for measles is at risk for that. And so I think in 2024 there was, or maybe a couple years before that, 2020 to 2024, there was only a couple hundred cases of measles spreading. And so in 2025, there actually then became a total of 2,283 cases of confirmed measles in the United States, and we did have 3 deaths from that. When we look at this year, this is looking at January 1 to March 6, 2026, and there have already been 1,281 confirmed cases of measles here this year. And that's already in the 2 months of 2026, we've already hit 50% of the cases we saw last year. So not to scare anybody, but it just is to put it out there that it's not seeming to be going away. And so it's just something that we really want to keep talking about and making sure we're protected from. So with that being said, social media and vaccine hesitancy. So I just want to briefly hit on that, especially in the midst of, these measles outbreaks. So social media has reshaped how people decide what is or isn't true, especially regarding vaccines and health. We moved from local news and newspapers to algorithm-driven feeds where emotions and fear and all of those things tend to outperform accuracy. Social media is different from traditional media. Again, that algorithms reward engagement. The longer you spend on something, the more you're going to see that type of content. And this tends to favor messages of fear or some kind of secret knowledge that people aren't telling you. Both social and traditional media influence who people trust, how vaccines are framed, and misinformation is spread really quickly that way. In the early 2000s, misinformation begins to be mainstream. Media coverage creates this idea of legitimate scientific evidence. And so one example is vaccines and autism. I mean, you have public figures. I mean, we know Jenny McCarthy has come out and said certain things regarding vaccines causing her child's autism. And people then are hearing this in mainstream media. They're taking somebody's testimony and using that as scientific proof. So as years progress, social media becomes low cost. It's a fast way to share any kind of content. And again, especially persuasive content for specific types of communities. And again, this is whether that information is true or not. And then once the COVID pandemic hit, that really was a huge shift of people getting a ton of health information from social media. It created a nonstop information demand where misinformation was filling in the gap faster than healthcare professionals could come out with correct information. And so this stuff was really spinning out of control, and that really took heightened effect during COVID. And then the Pew Research Center found half of American adults were getting at least some type of COVID vaccine news via social media by mid-2021. So all of that is happening. A measles outbreak is happening, and now we have members of the federal government who have the loudest microphone, and they're making vaccine decisions not rooted in science. Connie mentioned that a little bit. Dr. G is going to talk about that a little bit more. And again, AAP released their own immunization schedule, really breaking from the CDC schedule for the first time in some 30 years. So that was a big deal. And of course, this rift between the nation's pediatric leaders and federal health officials has deepened some of that mistrust and confusion. They're hearing stuff from social media, from friends and family. They're hearing stuff from doctors, from the federal government, and there's a lot of information coming at families in all kinds of capacity. And so, of course, families are confused. I mentioned when I do vaccine education that before I worked at SuperShot, I've been a nurse for 10 years, but before I worked there, I knew there was an immunization schedule. I knew kids got vaccinated at certain time frames, but I had no idea what children got at what time. And so if I was a trained medical professional and didn't know that information, like I'm just, thinking of families who have no medical knowledge and they just have no idea what's going on. And obviously some people are doing their own research, and again, there's just a lot of information coming at families. And so it's really important for us to highlight that, just again, why are families confused and what's going on. So with that, we'll have Dr. Tony Giaquinta come up and share with you guys just some of the changes and combating some of that confusion.
Hi. Well, everyone, thanks so much for inviting me. It's really good to be here. Tony Giaquinta. My why, I have a few of them. I'm a dad too. It's my favorite role in a husband. And I'm also from Fort Wayne. You know, that means a lot to me. I was born at St. Joe Hospital, and I live on the south side of Fort Wayne with my family, and this is my home. This is where I plan to live the rest of my life. And that was a very purposeful decision for me. I trained to be a doctor. I've always wanted to be a doctor. I was one of those lucky ones who always just felt like I had a goal and was able to have a North Star that I just kept trucking towards. And it was really early on that I wanted to be a pediatrician. I always felt like that was my calling. It just felt like something motivating for me, knowing that, you know, I could make an impact on something so small and have it grow up to be something so great, and to leave these little legacies, you know, as I proceed down my career. It's just something that meant a lot to me. And so when it comes to things like being a pediatrician, being a dad, it's just natural for me to want to be able to give the right medical advice, the right guidance, the right treatments to make that mission achievable. And so, you know, for me, vaccines are just one of those opportunities for me to make sure that I am doing my job to be a strong advocate for the health of our children. My goal today is not to convince any of you that vaccines are safe or that they're effective. Okay, I don't want to convince you of that. I want you to feel like you can convince yourselves, for you guys to ask the questions, for you guys to lead with curiosity and take advantage of the resources that you guys have to come up with those answers. And you guys heard a lot of really great information from some vaccine experts. And so you're probably going to want to have questions and compare the things that you heard today with maybe things that you're hearing from relatives on social media. And that's really important for you. And I hope my presence here is important for you too, so that you can ask me some of these questions that you're hearing, because that's where we really develop understanding. Because most importantly, again, I'm your neighbor. I'm a dad. I send my kids to Fort Wayne Community Schools every day. And so I'm here, I'm about, and I don't want to be peddling snake oil to you or giving you false beliefs or misconceptions. I want to lead with honesty and humility that I don't know everything either, but I do have a lot of experience in this. I do have a lot of passion for this. And most importantly, I want our kids to grow up healthy and strong and safe, just like you guys. And so that's why I devote so much time and energy into this. It's important to know some of my disclosures. I am the medical director of SuperShot, and I don't receive any money to do this. This is, again, something that is so important for me to donate my time so that I can help you guys kind of be passionate advocates for vaccines, hopefully, too. I am a pediatrician, and I give vaccines in my office. I don't see paychecks for giving vaccines. There are quality indicators historically for being able to show that your patients are healthy. And one of the best ways that we believe is to show that your patient healthy is to prevent them from getting sick. So that's why we do have goals to vaccinate children. Now, I will tell you, as the Parkview physician leader at Pediatrics, I've removed all those from our clinics, because I don't want there to be any misconception that even though I do feel like it's important that this is a sign of quality, I don't want there to be any biases that we're doing this to receive extra money or financial gain. And that has been something that has been in the news lately, that we're getting rich off of vaccines. Like, actually, we would get a lot more money if our kids got sick and we were treating them with money than hospitalizing them. This is a way to save money. So those are probably the biggest disclosures that I have. But otherwise, I'm here. I don't, accept money from pharmaceutical companies or any of that. So there's the prologue. Changes in combating confusion. I think this was documented really well by Connie. There was a lot of changes over the last in the last year, and that causes confusion. And when things are causing confusion, I think that causes a lot of angst and worry as well. I get that. That makes sense. Because the biggest question you all should be asking is, why the change, right? Because we had a vaccine schedule that we claimed was rooted in science, that claimed was safe, that claimed it was effective, and now we're changing it. So the big natural question is one of those things must not have been right. It must not have been safe, they must not have been effective, and they must not have been important, okay? And that's what all of you guys should be asking, which one of those three was it? And I'm standing up here today to tell you, I don't know. I don't know that any of those 30 things were not true before as they are today. I don't have any new information from these changes that any of those big three things are true, that they are not safe, that they don't work really well, and that they're not important. But let's go through some of those. Basically, they made 3 different categories, and they said we need to change our vaccine policy because our vaccine schedule is not the same as Denmark's. Denmark, and I have nothing against Denmark. I don't know any Danes. I only know them mostly through Macbeth, but I assume they're great people, and I don't mean to diss their vaccine schedule. But I don't understand why their schedule was better than ours. And I'm not convinced that anybody from HHS has convinced us that it's better than ours. It's different, but why is different necessarily better? They vaccinate for less diseases in Denmark than they do the United States. But again, it hasn't been shown to me why that is actually a better thing. And again, you'll see that they wanted to say that, well, this is how peer countries do their vaccine policy, and we should be more like them. But that's not necessarily true. You can see that there are a lot of countries that actually are on schedules very similar to ours. But they wanted to say, well, we want to restore the trust in vaccines. But when you change something without giving an appropriate explanation for why, I think that sows discord, confusion, and actually does anything but restoring trust in vaccines. The other problem was that this change was made very unilaterally. It was not made with discussion from our Infectious Disease Society of America, the American Academy of Pediatrics, the people who actually get these vaccines and vet them. And there was no real transparency on why they actually made that decision. And of course, they also chose a country that had the most limited vaccine schedule to really show how bloated ours looked in comparison to theirs. Again, for you guys wondering, boy, that is a big difference. Why are we doing it that way? That sows confusion and discord. And finally, it's just important to know, we're just not Denmark. They have a completely different healthcare system. They have different populations. They have more insurance than we do. And so it's not an apples to apples comparison. And again, questions, why are we picking Denmark as the model for immunization schedules? The second one's really important. Fewer vaccines against fewer diseases. We don't know why that's a good thing. If you are able to be protected against a disease, and if the presumption that the vaccine is safe and that it works really well, if you have a choice to be protected against that vaccine, and our insurance companies and government says, yeah, it's important to do this, we're going to pay for it and make it cost effective to do that, then we don't understand why more disease is a good thing. And then, of course, again, clear recommendations, making sure that all of our societies are aligned with these decisions also makes a lot of sense too, if we're going to want to actually restore confidence in vaccines. So this is kind of a typical schedule, and it's a lot, right? These are a lot of shots. A lot of them are combined together to kind of lessen that burden of actual pokes. But these are shots, and when you look at the ingredient package, you're not going to recognize chemicals that are going to seem really dangerous, right? And that's going to, whenever we don't understand something again, that's going to sow a lot of fear and discord. And so when you look at these and you pull up a shot record, this is going to look really intimidating. And so separating what this looks like from the actual outcome, which is a healthy vaccinated child, is a little bit of a leap in trust. And there's always going to be a leap in trust when we're dealing with something that's very scientific, something that requires a lot of medical knowledge behind. At the end of the day, even I am not going to fully 100% stay up here and tell you that I can tell you the biomechanical engineering process that goes into a vaccine, and talk about all of the THC1, 2 helper cells B, immunology, like antibodies and how that all works. Okay, I have a good understanding. I would say better than most. I took a lot of immunology in medical school, as did every doctor. But there's always going to be a leap in trust when we're trying to understand something that's complicated. And so that's what's important to remember in this vaccine debate too, is when you don't understand something, it's going to sound confusing, and that's going to really rely on what relationship you have with the person that is saying that they're speaking from a point of view of fact. Okay, are they a physician? Are they a doctor? Do they take care of kids? What are their biases? And really trying to understand that when you're trying to make a decision like, are vaccines safe for my child? So there were 3 categories that they made. The first category that they said is vaccines that are recommended for all. And you'll see, again, if we were trying to answer the questions, are they safe, do they work well, and are they important? They left a lot of vaccines on here that would be descriptors of these. So our tetanus is on there, the polio shot is on there, pneumococcus and Haemophilus influenza. These are the most common causes of meningitis, which is a brain infection, and pneumonias. And then we also have measles, mumps, measles, mumps, rubella, varicella, and also HPV, by the way. That is still a recommended vaccine, which some were surprised by because this has received a lot of controversy. So if throughout these changes they're questioning whether they're safe, effective, and important, these are all on that list. These haven't changed at all, except for HPV did receive new data from December, recently 2025, that is wondering if just one shot of HPV produces the same immunity as 2. We're not quite there yet to understanding if that's exactly true yet, but there's some really good data that supposes that might be accurate. And that is great news, right? This is how science works, is we get these big studies that show that one dose versus 2 doses is just as effective. And then from there, we can make changes in our recommendations. We've done this a lot through our vaccine schedule, and that's a good example of it, actually. Some would argue that we're not quite there yet to saying that it's as effective, but there's good data to suppose that, and that's actually one of the ones that I'm actually really happy might be a positive change. But then we get into other categories that, again, we have to look at that I'm a little more skeptical of and I don't understand. One is that some vaccines are recommended for certain high-risk groups only, okay? RSV being one of those. RSV is a virus. It's a virus that all of us get probably every year, to be honest. We just don't really know it. You get a head cold, you get stuffy nose, some of you probably have it right now. And it's annoying for us. We just don't feel good. But it's miserable if you're a parent with a child with one of these viruses, with RSV, or if you're actually that child, especially when you're very young as an infant, when you don't have a strong chest wall and healthy, mature lungs. Getting RSV is at least 2 weeks of being miserable, up all night with a cough, congestion, and mucus, and there is not one validated medical treatment for RSV. It is vitamin T, which is time. This is the most annoying virus that I face every year. Every year this virus comes back, and it is a pain in the ass. So great when about 3 years ago, they came up with a vaccine. Okay, we're going to call it a vaccine. It's not maybe technically a vaccine. We'll call it that, against RSV. Now, here's something you might not know is that we actually had a very similar vaccine for RSV before this. It was called Synagis, which is also called and Synagis truly was a vaccine recommended for certain high-risk groups, and here's why. Because for Synagis, the cost of it was extraordinary. One shot was over $2,000, okay? Worse than that, you had to get a shot every month because the antibodies that protected against RSV, that didn't last long. It only lasted a month. And so we said, hell no, we are not giving this to everybody. It just wasn't worth it. From a healthcare perspective, we couldn't afford that, to give that to every kid. And it just, to get a shot every month that's a lot to ask. So we decided that no, this is going to be for certain high-risk groups. You can only get this one if you have if you're a very premature baby, okay, under 28 weeks, okay? Or if you have a congenital heart disease, right? So these kids, if you get RSV, you're not just miserable for 2 weeks, but there's a good chance that you could get very, very sick and possibly die. And so for these kids, we're like, yep, we're doing the Synergist. It makes sense. We're going to pay for it. We're going to do it once a month. Pain in the ass. We're doing it. So that is a good example of a vaccine for high risk. But 3 years ago, something awesome happened. They figured out how to get that antibody to last the entire season, right? So over 8 months long. So with one poke, right? With one poke, your child could be protected against RSV for the entire first RSV season. This was, to me, the best thing that has happened in my medical career. It really was. This was the eureka moment for me as a doctor because I hate this virus. And so it's confusing, and it's also much cheaper than Synergist. But so it was confusing when they said, no, this is only for certain high-risk groups. Well, if you have a baby, okay, and they cannot protect themselves from a virus that circulates every year, and they are also very medically fragile, then yeah, to me that would fit the bill for being a high-risk situation. So again, confusing because when they took this off the recommended, your first question is, it's probably not safe, it's probably, or it doesn't work very well, or it's probably not important. None of those three fit for that one. And I don't have an answer for why they took that off that list. Other ones, hepatitis B has been in the news a lot. I'm really happy to talk about hepatitis B and why that was changed and what things we can consider now that it's not recommended for newborns. And then meningococcal vaccines as well. These vaccines, we're used to shots like the measles, mumps, and rubella shots, which is a live vaccine. And boy, once you get one shot of MMR, you have a over 90% chance of being immunized for the rest of your life. That's an awesome vaccine, okay? And even our vaccines against polio, when you get them in series, have an excellent record of protection. I mean, many of you in this room might have a relative that had polio in the early, that they contracted, and even as early as like the 60s. We just don't see that anymore. These medicines work really, really well. But meningitis is one of those where it works pretty good, but the disease is devastating. The mortality of having meningococcal, which causes meningitis, is extremely harmful. And so, again, like understanding why they took that off of recommended if your kid is going into college and is going to be in a close-quartered environment and possibly get infected with a bacteria that could end your life, I think a lot of us would say, boy, that is a risk factor that we should continue to encourage vaccination for. And then we have another category that is also confusing. Immunizations based on shared clinical decision making. I want to tell you right now that, again, as a disclaimer, I don't force any of my patients to vaccinate that come to see me, okay? I expect them to listen, and be curious about vaccines and to be able to have discussions about them, but I never force a patient to vaccinate their child. Most of them do. Almost all of them, actually. And that's because when we come and we talk and they develop trust with our relationship, the truth is that every family has a choice when they decide who their pediatrician is. And they're going to choose a doctor that they trust. Why else would you do that? And they're going to choose a doctor that they feel is intelligent and that isn't a monster. So if I'm recommending something like immunizations and giving a strong recommendation for that, I assume that you don't think that I'm a monster and want to harm their kid or that I'm incompetent, right? And so with that, I feel like a lot of families, after we meet and talk for a while, they start to understand why I find vaccines important. They develop a little bit more level of trust, and they decide to vaccinate. And sometimes we take it slow, okay? And that's not something I necessarily recommend, but it's something I understand. Because the most important thing, again, is for their child to be safe and for my waiting room to be safe as well. So I have to think about all of those things. These vaccines were put on this needed shared decision making. And I guess what I wanted to get to is we've always used shared decision making. That was always inherent in the discussion and my recommendations in my relationships with my parents. So taking that off the list is a little confusing to families from recommended to well with shared decision making, because we've always done that. And it gives the impression that maybe these vaccines you want to talk about because maybe they're not important, maybe they're not safe, maybe they don't work very well. And so again, I just don't understand either of those three criteria for meeting these vaccines. An analogy for this would be when we had hepatitis, when the HPV vaccine first came out. Most of the HPV virus is spread during an adult's younger years when they're having more sexual activity or maybe not having monogamous relationships. But then for like a married 30-year-old, does it make sense to get the HPV? And so that HPV vaccine was really a shared decision-making recommendation. So if a woman in their 30s wanted to get HPV, they would talk about it with their doctor, and they would kind of go over the risks, based on their relationships and where they were in their life to decide if that vaccine was important. And I think now, we're recognizing that, yeah, it's so important to get that vaccine because there's a lot of other benefits that we're finding from that vaccine. But this was an example of one that, yeah, let's talk about it and let's see if it's right for you. That doesn't really fit the criteria for these vaccines. Okay, you are the trusted messenger. Am I doing this part or? Sure. Okay. I've talked a lot, and I'm sorry. I have not let you guys raise your hands or anything, but do any of you guys have any questions so far? Oh, good, this is great. Yeah, Rebecca. And yeah. Yeah. Oh, this is such a good question. Yeah. No, sorry. Good question. So Rebecca asked it's like, well, how do we message something like HPV that is transmitted by a virus that is sexually transmitted? Actually, similar to hepatitis B, so we can talk about both of those together. And how do we kind of engage in a conversation? Well, first of all, great point, Rebecca, the doctor looking at the computer. That's always frustrating. When you're with a interpreter and you're giving medical advice, your goal is for the interpreter to be here, okay, and the patient to be in front of you. You're not talking to the interpreter, you're talking to the patient. The interpreter will actually do the translating, but the goal is for you to still make eye contact with the patient. That is really important. Now, the family's still going to usually talk to the interpreter, I find, but that's okay. But that level of eye contact is important. So that's one thing to know. The other thing that's important to know about HPV is there was a concern when it first came out that it was going to promote promiscuity. That getting the vaccine is too close to being related to sexual activity and being kind of like, well, you can now have more promiscuous sex. I hate using that word because you are now protected against HPV. And that's actually, for me, the reason to do it. Younger ages, in fact, the younger you actually get better protection. So even as young as age 9, your child can get HPV, and both of my children have gotten the HPV vaccine. And that's kind of helpful, I think, because it actually helps separate that relationship between sexual activity, that we can get the messaging that we are going to protect against HPV for when your child decides to have sex, okay, whenever they are ready to do that. We are going to assume that they are eventually going to have sex, and that when they do, we want them to be protected from this virus. And then again, the immunity that you generate against HPV is all of a sudden showing all of these other types of benefits that we didn't even know about. It's actually reducing other types of cancers that we didn't anticipate at all. And again, boy, if there is one vaccine that I'm really impressed with, this is a vaccine that prevents cancer. This is the only medicine that we have that actually prevents cancer from forming. And so again, kind of delivering those messages is a way for me to help motivate the why for that vaccine. The same thing would be for hepatitis B. We assume that we don't want our children to ever contract HPV. HBV, hepatitis B. Hepatitis B vaccine is usually transmitted sexually, usually, but it is a virus, okay? Viruses live in other places, including our mucosa, and if we have a lot of spreading hepatitis B, then we're going to see more hepatitis B. And for example, we don't see this a lot right now, but there is a such thing of horizontal transmission, which is from me to you, versus vertical transmission, which is mom to baby, that is not sexually transmitted. And if we can see more hepatitis B in our daycares, there is a risk that your child or your young infant at daycare would contract hepatitis B horizontally. The risk is really, really low, really, really low, but it's a chance. And more importantly than that, we are eventually, again, going to assume that our child is going to have sex and that they're not going to screen their partner for hepatitis B before they have sex. So most of us agree that, yeah, eventually we all want to be immunized against hepatitis B because the liver cirrhosis and liver cancer that ensues has a significant chance of morbidity and mortality. So the question is when is the best time to get that? I mean, for me, if you can get it at a young age and just be protected against it, I'm all for that. I'm okay with that. Because some people say, well, why don't we just do it at 8? And I would say, yeah, that's okay too, but is it okay to still do it when they're very young? And the answer is yes. There's no data that shows that hepatitis B is dangerous for the child. And we can talk about aluminum and things like that, happy to. But in my experience, I will tell you that we've been immunizing for hepatitis B since the 80s, and we continue to find that it is safe and that it works really, really well. And so that's why the change didn't make sense for me, is I didn't get any information that the current vaccine policy was more dangerous, that it was more effective, or that it wasn't important to do that. Sorry, long answer, but great question. And I'm, again, happy to talk more about that too. Any other questions? Somebody else had their hand up. Oh, yeah. So a negative hepatitis, go ahead. Shared decision making and at 2 months now. They are not recommending getting it at birth. Only with shared decision making and later. And without no data that the birth dose is dangerous. It just feels yucky. And it does. It's going to be a chemical, and it's a newborn baby, and it doesn't, maybe and you're seeing these things online and everything, and it just doesn't emotionally feel good to poke a baby that young. But is it dangerous? Does it work? These are questions that I have to ask myself. And for me, the answer is yes. Go ahead. Yeah. Oh man, we're really worried about that. We're really worried about that because if the CDC says it's not recommended, then it's not going to get paid for. They assured us that it was going to be. But we're really worried about that, and I'm going to hold them accountable for that. It's a great question because VFC, which is our Vaccines for Children program, pays for hepatitis B for newborns, and if it's not recommended by the government, are they still going to pay for it? The chances of a mom being negative, transmitting it to their baby, is low. It's not zero. It's very, very low. But it's not zero, and I can still understand the parent just wanting to protect their child as early and as safely as possible. We would never separate one from the other. Yeah. What's your name? Shelby. Hi. Yeah, hi. Mm-hmm. Yeah. Yeah. Mm-hmm. Yeah. Boy, it's a really good one. It's frustrating because I have a lot of children with autism in my clinic, and they deserve more than us spending more and more resources on validating studies that show that it doesn't cause autism. They deserve better than that. They deserve more from us adults to look for what is causing autism. I am all for when RFK says we need to find the roots of autism and the causes for that. But I need to hold him accountable for leaning on his scientists to do that. I guess to answer your question is, it's going to be hard for you to really motivate or move that elephant. There's a phrase where if you want to move an elephant, you have to motivate their heart, because you won't be able to push them to do that. And that's going to be hard to do because you need trust to do that in a relationship. Measles is, I'm starting to become resigned to the fact that our communities might have to find out for themselves. It's spreading. It will get up to Fort Wayne. We are not at herd immunity any longer. And it is extremely contagious, and we're going to see some sick children. And we've forgotten about measles and why we vaccinate against it. And I'm not sure if there is a messaging that you can give that can convince them otherwise. I think that you have to lean on your experience and give a strong recommendation. There is no mercury in measles. I hesitate to even say that because it wasn't a mercury. There's a difference between ethyl mercury and methyl mercury, and they're very different. It's like water and hydrogen peroxide. They both have very similar ingredients, but they're totally different from each other, totally different. But a lot of people have concerns about mercury in the MMR. It's not there. It's not in flu vaccines anymore either. But that's not what caused autism, clearly. The evidence, but you won't be able to quote evidence necessarily or explain why their studies aren't superior to your validated studies. Yeah, do your best. I think we're going to find out.
With measles, what's the age range that is being seen most, I guess?
Yeah. So the recommendation currently is and again, the studies that we have for our vaccine schedule, there's a reason why we do it at 246 and not 135. Okay? The reason why we do it at 246 is that is where we did validated studies to show that this is the quickest way that we could immunize your child and still be safe. Okay? 135 might be also as quick, but we don't know if it's as safe. It's obviously quicker. We don't know if it's safe. Okay? And so, in other words, there's a reason why we do it in a certain time. We know that giving the measles vaccine at 1 is safe and that it works really, really well. We're not quite sure about 6 months, but maybe. Okay? Maybe we've some extrapolated data that shows that it probably is safe. But we're not there yet. That's why we're not doing it. We will never compromise safety for efficacy. Okay? But if we are in the midst of a big measles outbreak in Fort Wayne, and this is going to happen, okay? We are surrounded by a very highly unvaccinated population. You might decide, I want to do everything to immunize my child earlier. And so we do have protocols to do a vaccine at 6 months of age, okay, to help boost their immunity at an earlier age. But it's not going to count towards their immunity. Okay, we're still going to say you need to get your 1 month shot and then get another one probably about 3 months later. Okay, you can get your MMR 3 months apart and considered fully immunized. The reason why we don't do it is because one shot is so effective that we're saying it's okay to combine it with your 4-year vaccine. So that's why we do it at 1 and 4. But you only need a shot at 12 months and then wait 3 months later. Again, this is a live vaccine. So with one shot, you're going to be about 92% protected for the rest of your life. But we want to do another one just to get that extra 8% or so that women get protected. Yeah. What ages are the kids that are getting measles?
Yeah, that are
or sick?
Yeah.
Oh, well, boy. I mean, the sickest kids are going to be our most vulnerable, right? Our really young infants or our kids that are immunosuppressed. Again, we don't only vaccinate to protect ourselves, right? We need to protect each other, okay? This is what God wanted us to do, is to take care of each other and to love one another, right? And this is a way for us to do what we are supposed to do, which is love our neighbors, okay, and protect them. And if we can immunize ourselves to protect our youngest population, our babies, then yeah, this is a calling that we should do as a community. So again, I'm just pointing that out as we don't do it just, even if you have a little bit of doubt, you know, it's okay to kind of think about, man, immunizing ourselves and our community protects the ones that can't protect themselves. You know, you'll see if you're unvaccinated, you're gonna get it. If it's in this room right now and you're unvaccinated, you will walk out of here with measles. It is the most contagious virus that we have, and it will make you sick. You'll feel really, really lousy. The chances that you die from measles is low. You know, we've had 2,000 cases last year and 3 deaths. But never say only 3 deaths. Never say only 3 deaths, especially when it's a child. Those are 3 preventable deaths.
Sorry, I guess that was more like my question, like the 3 deaths for the children.
Oh,
or adults, or,
I know at least a couple of them with children. I don't know if all 3. Yeah. 2 children, 1 adult. Yes, ma'am. Right through this time.
Kiki.
Hey, oh, hey, Kiki. Sorry, I didn't see you there.
Well, first, I just want to say thank you for all the work that you do. You do amazing work, just within all of your clinics and just out in the community. So I'm sure you've heard it, but if not, just thank you.
Yeah, I'll give you my wife's phone number.
Yeah, please.
Shoot her a little text. She would love that.
Also, though, I just also want to just say thank you too, because just this past week I heard a doctor say that if a patient comes into their clinic, she makes it mandatory that all babies receive vaccination. And so to hear you say that it's not mandatory, but you provide that education to them, and then they eventually will, get the vaccination. So I think that's just important that they have a voice and you don't take their rights away,
Yeah, their autonomy, right? Yeah, we're all rational, autonomous beings. And I have so much patience and time for the vaccine hesitant, because I get it. It is hard to make a decision these days. The vaccine cynic is a little trickier. The one who crosses their arms and saying, nope, never, I don't want to listen to you, forget it. But at that point, I'm also like, why are you coming to see me? Like, why wouldn't, if you actually think, if you have this much skepticism towards me as a doctor, then this might not be the best relationship for you. You might want somebody that you trust a little bit more. And so that's a lot of times what we want. At the end of the day, I do need herd immunity in my clinic, right? I need my kids that have cancer to feel comfortable coming in. I need my unvaccinated 6-month-olds not to be able to come in and not be afraid of measles. So, I get it to some extent, but at this point, I'm still really effective at having my families vaccinated because they want to, not because I want to move a little bit. I don't know if this is move fast. There we go. We'll get to that one too. Yeah, question. Yeah, it doesn't have to be a last one.
Okay. Will clinics start moving to not accepting children that's not vaccinated?
There are clinics that do that. At this point, and maybe, hey, to be fair, maybe they got burned. Maybe, one of their kids that had cancer was in the waiting room and they got a vaccine preventable disease and they're like, never again. I get it. In a pediatric office, again, you're going to have more kids, more vulnerable kids than a family practice, So, if we're in a huge measles outbreak, right? Yeah, we're going to probably pressure our families just a little bit to get the measles vaccine because we're in an outbreak and we need to protect our vulnerable. Until we get to that point, I think that, most clinics are pretty flexible with that. But there's been a notable shift from us as pediatricians to being a little bit more strict to kind of being, okay, we need to kind of approach this in a different way. And so, again, with the government having different recommendations, yeah, we get the confusion. So,
And I think the last thing that I heard, around, I'm with BTS. I don't recognize it. Is that I think all of our kids are moving to your office. I think that's my new
oh, okay, yeah.
Look, you don't know. I know. You don't know. That's crazy. But yeah, I think that was the new thing that since our kids have to be seen within 48
our
hours.
Our foster care bridge.
Yeah, I think we're bridging the gap with us and you. Yeah. So your office cannot do that.
No, we wouldn't do that. Yeah, and that's the big goal is honestly that we help bring them in, and if vaccination is important, then we'll do that too. Yes, question.
If you will speak to how vaccine studies are actually done.
Oh, really good one. Yeah.
And then also the argument that people will sometimes make, well, if a vaccine is so effective, why does it matter if I don't vaccinate my children?
Yeah.
So if it's not effective, does that make sense?
Great questions. The first one, vaccine studies. So you'll hear this in the news is that there has never been a double placebo-blind study on one of these vaccines. And there is some truth to that, okay? But this is why there will never be double-blind placebo studies on immunizations. Because if you're going, number one, if you're going to say, okay, because the presumption is children that are unvaccinated are healthier than children that are vaccinated. So if you're going to bring me your infant, and we're going to study the pneumococcal vaccine, which prevents meningitis and pneumonia. And we're going to sign you up for a trial that says you'll either get the pneumococcal vaccine or you'll get placebo saline or something. Okay, so we're going to give both kids a shot of that. And you have to sign up to see which one you're going to get, which would be chance. Nobody would sign up for that study. And in fact, no ethical commission would allow that study to happen, because we already know from years and years and years that these vaccines are really important and that they work really well. We couldn't risk having some children get placebo and get meningitis or pneumonia. That would be so unethical. And that's why it's really, really hard to do these vaccines in kids, because it's hard to sign up to be the variant or the placebo group when you have something that works really, really well and is very effective. Now, that makes it hard to design these studies in the first place to make sure that they're safe and work really well. So much research has to go into trialing these vaccines, doing the animal studies to make sure that, as to the best of our knowledge, that they're going to be safe. And to be truthful, they rely on them on time. Okay, doing these studies, watching them very closely. This is how they did it with the COVID studies, because there was a short amount of time to figure this out. And then they got enough data to see, okay, looking at the side effects and the efficacy, let's go for it, okay? The problem is, your second question again? If they're so effective, yeah. So quick comment, the problem with the COVID studies was that, yeah, they looked like they were going to be really safe, but we didn't have a ton of great data to see how well it actually prevented COVID. We knew that it saved lives when we compared the groups, but we weren't sure of actually how effective it was to preventing it. And so that led to a lot of distrust in the COVID vaccine, because a lot of people got their COVID shots, including me, and still got COVID a lot. But I never wound up in the hospital, which was really important to me. And so I think to answer your second question, then, it's really, it goes back to messaging that we vaccinate to protect ourselves, okay? But we also vaccinate to protect each other, to make sure that we have herd immunity. So when a family's saying, like, if they work so well, why do I have to protect my child? It's because we don't know what it's going to look like 10 years from now, when that population all of a sudden is unvaccinated. I mean, it's really convenient for these parents to say, I'm not going to vaccinate my kids when they are healthy, vaccinated adults. That's a little bit of a disconnect. But again, I think you have to lead with a little bit of curiosity and then come up to a shared goal of, I can see that you're making this decision because you want your child to be healthy as possible. And I want that goal for you too. So let's talk about how to get that goal. And let's see if immunizations are really a part of your child's growing up to be healthy or not. And I think usually once you have some shared understanding, you can get to that point. We'll do maybe one more question, and then we'll show you the PSA again.
Mine's just kind of piggybacking on your response to her. So, because of the ethical issue with doing the double-blind studies, what has been done to get to us being confident in the safety of the recommendations that we have for the vaccines?
Yeah, I mean, truthfully, like, it's a lot of dipping the toe in the water. Okay.
You mentioned, I think, animal studies. Is that what
Yeah, they'll do animal studies, but that's not going to convince us really well.
Sure.
That'll give us like, okay, it's dipping our toe in the water just a little bit at a time when we do these vaccines. They're very difficult to do. It costs a lot of money and a lot of time before a vaccine goes from, trial to actually approved for by the FDA. Usually 10 years or so. I mean, this is a lot of dipping our toe in the water to make sure that this is the right cadence of getting the shots. This is as young as we can go. And so, signing up for those things is really important. But what a lot of people are trying to argue is like, well, this shot we haven't compared this shot compared to like a different schedule. And I'm like, well, if 2 months, if you compare giving it starting at 2 months to 4 months, the only thing that's showing a difference is that you're not going to have immunity for 2 months, right? And that's going to be proven. We're going to know that. But the question is it safer to do it at 4 months to 2 months? Again, we have all of this data that shows that it is extremely safe to give at 2 months, and we don't have any reason to show that it's not. That's from my opinion. So really hard to show like that alternative schedules are safer when we don't have any data to show that the current schedule is unsafe. Yeah, hard to do. So with all that said, Connie and I, back in December, with all this being said, we were just like, we've got to do something. We've got to rally the clan, and we need to do something for Fort Wayne. We see the skepticism and everything coming from Washington and the federal government, but we don't think that Fort Wayne families are going to necessarily buy that or believe that. We think that what they really want to do is they want to listen to our doctors, our pediatricians. But we also didn't want it to just come from a Parkview doctor or from a Lutheran doctor or from SuperShot in general. We wanted, again, to restore trust by having that conversation from all of Fort Wayne's providers. Okay, we wanted our message to be, I'm a pediatrician or a family practice doctor, and I'm not speaking on behalf of IU or Lutheran or Parkview. I'm speaking on behalf of me wanting what's best for your child. And I'm speaking on behalf of me just wanting to be a good listener and that I get it, that we're here for you. So that led to the script, and this led to a very easy, yep, I'm in. It was actually, from process, to getting us into the video room took like 3 weeks. Just kind of people just saying, yep, I'm in, we got it done. And then we needed to raise funding for it, so we just kind of did some local crowdsourcing, and $30,000 later, you're seeing this bald guy on the TV a lot. It was a lot more successful and easier actually than I ever thought. It's been a fun model actually for a lot of other communities that have replicated. I just click it. Okay.
Parents, from the moment your child was born,
we've seen the joy and the responsibility in your eyes.
We've been there with you, helping you through everyday worries.
car seats, baby monitors, fevers.
And now, one choice feels heavier than ever.
Vaccines.
Vaccines.
Vaccines. Many parents choose them with confidence.
Others pause, and we understand why.
Misinformation spreads faster than ever.
From viral posts to celebrity claims that sound convincing,
but aren't rooted in science.
As your local doctors, we want one thing.
For your child to grow up healthy.
And through all the noise, one truth remains.
Immunizations help keep your child safe.
We've read the research and understand the science.
More importantly, we know you. We've cared for your children in the ER.
At your pediatric offices.
At school visits and community events. We've always had your back.
We're your neighbors, your doctors.
Right here in Fort Wayne.
I gotta get back to clinic. My nurse is, I'm sure, texting me right now. But yeah, you guys can reach out to Connie. You can get a hold of me easily. If you guys have more questions, happy to talk kind of one-on-one too, because I know that there's a lot of probably sensitive things. But what I mostly want you guys to know that there's no vaccine-like question that's going to make an uncomfortable discussion with me, at least. Bring it on.
Thank you so much, Dr. Giaquinta. That was really great, and we really kind of naturally went through the Q&A, and I know that we're past time, and I appreciate you guys all staying around to listen. It was easy for me to listen to him. What a wealth of knowledge, and honestly, to hear from somebody locally who is a father, who's dedicated to our community, I think is just that much more powerful. Thank you to Connie and Danyel as well. If we could all please give them a round of applause. Okay, those are clinic calendars for the super shots, and we can also put them in the back table so people can grab them on the way out. You guys, if you could please do the survey, if anything, at least topics that you guys want to discuss, because I want to gear these around what you guys need. There's the QR code for the Healthier Moms and Babies survey as they're doing their strategic planning. Please, if you want to put your input, as it is the community they are serving and dedicated to, if you guys could do that for them. We will also send it out in the prenatal and infant newsletter if you guys are signed up for that. If not, there's a spot on the survey that you guys can put your email. But with that in closing, thank you so much for being here, and I will see you at the next one. Thank you.